Hi everyone, it's Andrea from AndreaTully.com. Thank you so much for watching this video. You guys are going to be so excited because today I'm here with Dr. Jasmine Johnson, who is one of my medical school colleagues and classmates. I love this girl, and she is an OBGYN resident at University of North Carolina, Chapel Hill, and she's here to tell you all about being an OBGYN resident, being a medical student, give us her vast knowledge on all those things. She's also a blogger, and I'm going to leave all her social media stuff down below so you can find her at her amazing blog, Mrs. Mommy MD. And then, stay tuned, we're going to do a part 2 video where she talks about all about being a mom, managing having kids, having a husband, being a resident medical student. This woman is amazing, so stay tuned for some goodness. All right, well, Jasmine, thank you so much for doing this video.
No problem. Thank you for having me. I feel like you just set the bar so high. It's great to hear someone talk about you.
It's so true. It's all so true. Can you just start and give us like a little rundown about who you are, where you're from, what your background is?
Yeah, so I was born in Detroit, Michigan, and then grew up in Northwest Indiana, about an hour outside of Chicago. My dad's a urologist, so when he finished medical school, we went to Chicago for his residency, and then he went into practice, where he's still practicing there. So grew up in small town Indiana. Then I went to undergraduate at University of Michigan in Ann Arbor. And then for medical school, so I did a year of a post-bac program in between starting medical school at IU. And that was actually through Indiana University. It's called the Master's in Science and Medical Science program. Wow. So I did that for a year, kind of beefed up my application for medical school, studied for the MCAT and all of those things, and then went to IU, where I met you, and did all of the craziness of medical school. Meanwhile, so my senior year at Michigan, I had my son Nate, who's now 7. So I went into medical school with an 18-month-old. And my husband, Nate, his name's Nate too. We got married the spring before medical school. So we got married in 2010, and then we started medical school like later that summer. Yeah. So I was newlywed. I say newlywed, newly med, and kind of a new mom in medical school. And so that was crazy. It was kind of insane. But it was fun. And so now we are in North Carolina. We're in Durham, but I am a resident at
not Chapel Hill, Durham. Sorry, I said that wrong.
I'm at Chapel Hill for residency, okay. But we live right outside Chapel Hill in Durham.
Got it.
Cheaper houses.
Perfect.
And before I graduated from medical school, I had my daughter Isabel. So she was born going into 4th year of medical school. So wow. She's 2.5.
She's so cute.
Thank you.
Both of your kids are so cute.
Thank you. They're so different. Like my son is very laid back, and I think it's because he was with me through like medical school and stuff. And my daughter, I feel like because I was a 4th year medical student, my schedule was very flexible. Yep. I probably was with her more than like most working moms. So she's very like high strung, and she doesn't like change, and she's very opinionated. So as far as kind of my path to OBGYN, so
tell us all about that.
Yeah, I actually, went into medical school with an open mind. Yep. Didn't really know what I wanted to do. My first exposure to OBGYN, other than just like kind of my annual health exams, was having my son Nate. And so that was I'd say that was a really challenging time in my life, like my pregnancy with him. And so I had a really great doctor, and she was actually one of my sorority sisters, like through my sorority at Michigan a few years before me. But she was just a great like friend, and we still keep in contact now, even though she's not my doctor anymore. So that was in the back of my mind, but I feel like OBGYN gets a bad rep for having a family and being in that specialty. It's now changed where it went from being like a male-dominated field, surprisingly, to now it's kind of 50-50. And so I think that the schedules and like the workload and all of those things have kind of reflected that. So I tried to not like it. I tell everybody, I'm like, I was like, well, I probably would like it, but let's see if I like something else. So I went through all of my rotations with an open mind, and I feel like I liked all of my rotations, and I kind of talked about them in my blog as I went along, mainly for myself, so that I could like figure out what I liked and what I didn't like. And I really liked family medicine, and my family medicine preceptor did obstetrics, and so kind of when I was reflecting back on things, I was like, well, what did I really like about that rotation? And it was the prenatal visits and delivering babies and all of that stuff. So my OBGYN rotation was actually the last rotation of my third year. So it was pretty late. But at that point, it was like the first week of the rotation, I was like, I'm with my people. Actually was placed on the maternal fetal medicine service. So I got to do like the high risk obstetrics and stuff.
Wow.
And so I think that's what I ultimately wanted to do. And the rest is history. But yeah, you know, it wasn't like one of those things where I came in knowing for sure.
Yeah.
So I still felt like I had enough time to like get letters of recommendation and find advisors and all of those things. Even though it was like the last rotation of third year, it was totally fine.
That's so good. Can you tell us just a little bit about like what an OBGYN does? Like what that field, what are the possibilities within that field, and what kind of things would be like your day-to-day besides like the delivering babies and what we all think of?
Yeah, absolutely. So obstetrics and gynecology, so the OB side obviously is like providing prenatal care and delivering babies, which is very fun. A lot of times, especially like in our population here, we have a large underserved population. So a lot of times that is like a woman's only entrance into the healthcare system. So we provide a lot of primary care as well, a lot of mental health. Of course, we refer when we can, but sometimes we're prescribing blood pressure medicines and checking EKGs, all the things that you think that like aren't OBGYN, but we do. And then there's gynecology. And so gynecology is women's health outside of pregnancy. So cervical cancer screening, getting like pap smears, you'll hear about that. And like the HPV vaccine is in the media a lot. So we are big proponents of that. Other things, so when a uterus does not have a baby in it, sometimes it has other things like fibroids, and you might have heavy periods, and so women might see us for those, and contraception, birth control. As far as subspecialties within OBGYN, so you can do a fellowship after residency, and there are kind of two paths. So you could say one is like the obstetrics route, where you get rid of the gynecology side. So like maternal fetal medicine is high-risk obstetrics, and you don't do any GYN after that. So you just focus on pregnancy management. Sometimes you deliver babies. Sometimes you kind of focus on like ultrasounds, genetic screening. There's a lot of things you can kind of make your niche within that side. And then as far as gynecology, so there's oncology, GYN oncology, so like ovarian cancer, cervical cancer. They do a lot of the big like laparotomy surgeries. So if you're really interested in surgery, GYN oncology is a great field to be in, because they do robotic surgery, open surgery, laparoscopic surgery. They also do chemotherapy, so you're managing like chemo meds and all those things, like the med onc team. Yeah, it's really impressive. Like my first rotation of residency was oncology, and so the intern is kind of managing the floor and things. But like the surgeries that they do, you're like doing bowel resections and reanastomosis, so like moving the ureter that's covered in cancer to a different place in the abdomen. It's like really awesome surgery. So you can do oncology, so that's a 3-year fellowship. You can also do something called minimally invasive gynecology. So it's GYN surgery. It's like a specialty where you do all like laparoscopy and robotic surgery. Which is better for like healing and that type of thing. So they also focus on pelvic pain, which is a really big field as well. And then there's reproductive endocrinology and infertility. That's a rotation I'm on right now. It's awesome. So like endocrine disorders in women who aren't pregnant, so like Turner syndrome, adrenal, weird things, like hermaphroditism and different like uterine anomalies. They deal with all that. But then on the other side, they help couples get pregnant. So they do like the IVF and different hormone stimulations to figure out how you can get your like menstrual cycles more regular so that you can conceive. So that's really cool. I think those are all the MFM, REI, ONC, MIGS. Yes, that's it.
That's a lot. That's so many different options, such a wide variety. And I really like that you said there's some specialties that are much more surgical than others, because all of OBGYN, it's a surgical specialty. Right. So like at the most simple level, you're doing like C-sections but you're still doing surgery. Exactly. And then you can get really complicated and be doing like crazy awesome surgeries too.
Exactly. And I think that's good, because I don't think I'm one that's like meant to be in a 5-hour surgery or a big X-lap. But I love C-sections. Yeah. Getting in there and getting out of there.
Yeah, exactly.
So yeah, there's something for everybody. And then, like within, those are the fellowships, but then as far as like how you make your practice, right. That's the good thing about medicine. There's so much flexibility on how you practice, because even when we were in med school, there were attendings that just had gynecology, like outpatient gynecology as their thing, or they, did like minimal GYN surgery, but they decided they didn't want to do obstetrics anymore. So even if you don't do a fellowship, if you decide you want to be like a general practicing OBGYN in the community, you can still subspecialize within that. So
right, that's so cool. That's great. Thanks. Thank you for kind of giving us the rundown there, because really the extent of my OB knowledge was my one like rotation on third year. And so tell us kind of the path. So you do medical school, and then how many years of residency is OB-GYN?
It's 4 years.
4 years.
4
and
years.
And you said most of the fellowships are 3 years?
Correct.
Okay.
The minimally invasive surgery specialist fellowship is 2 years, but everything else is 3.
Everything else is 3. That one is 2. Okay. And then, so like with ophthalmology, we're 4 years, but you have to do that one preliminary year where you can do medicine or whatever. But OB is not like that. You just go straight into OBGYN.
Correct.
Okay.
Yeah. Everybody, their first year is an intern, but it's all like at your program that you're at.
Right. So you don't have to go somewhere different or apply separately.
No, thank God.
Okay. And then in terms of, say, somebody's interested in this in medical school, how competitive is OB? Like, do you need lots of research? What are the best ways to get involved or to have a strong application?
I think that the field as a whole, I feel like our year that we applied, it was getting more competitive.
Yeah.
Quite a few people were going into OBGYN that year. And what I've seen with the classes after me, it definitely is getting to be more of a competitive specialty. I'd say like it kind of falls in the mid-range. Okay. Definitely not on the ophthalmology derm level, but it's like right in the middle.
Yeah.
As far as research, I feel like depending on what program you apply to, I think some programs are more focused on research, and so having that on your resume is definitely helpful. Okay. I didn't do like hard bench research in medical school. Yeah. I kind of did like a lit review type thing, but it wasn't anything serious. And I feel like that wasn't the focus of my interviews at all. Like no one brought up why I didn't do any like hardcore research. So I think that it definitely can make you look great, especially if it's something you're passionate about and can talk about, but I don't think it's like an end all be all if you don't have it.
Okay.
The big thing I think is just being able to articulate why you want to go into OBGYN. I think that a lot of people think, oh, it's just delivering babies and that's so fun and why wouldn't you want to do that? But I think having like a really good way to express why you like all parts of the field and kind of what you want to do with that is really important, because it's not glamorous at all. And so I think that if you are just attracted to kind of the fun side of it, people will see through that. Yeah. But good advisors is always good. So I think the one thing that I recommend to anybody that asks me about it is as soon as you decide that's what you want to do, I would just find someone you can talk to. It doesn't have to be an official advisor, and you can have more than one person that you feel comfortable just kind of bouncing ideas off of and getting input about the application process using other residents that might have graduated ahead of you or whatever. That's going to be the big thing.
Okay. That's really good advice. And then what's residency like? What are your days like? Is it super hard? Are you on call all the time? Like, are you up all night delivering babies?
Well, it waxes and wanes. Intern year is a lot more, I feel like it's more time in the hospital, like having yourself in the hospital 6 days a week, pretty much. And the way our residency program is kind of situated, and everybody's is different. Our intern year is basically all obstetrics. You do a couple of gynecology rotations, but for the most part, we're just delivering babies, C-sections, vaginal deliveries, getting our continuity clinic, so learning how to take care of women, both on the OB and the GYN side. And we do like an ultrasound rotation.
Well, that's fun.
But for the most part, like our hours as an intern are like 6 to 6 type hours. And then you'll be on call so many weekends. Usually we had like one golden weekend or one weekend off a month where you had Saturday and Sunday, which was nice. Second year is a lot better, and you kind of flip-flop. So now it's primarily gynecology. So this is when we get to try all of those subspecialties that we hadn't tried before. So like right now I'm on the REI, the reproductive endocrinology and fertility, and it's like office hours. So Monday through Friday clinic. We have one day in the OR. It's like minor procedure. So on Thursday we're in the OR, usually from like 7 to like 4 or 5. But most of the days it's like clinic that starts at 7:30, and we do ultrasounds from 7:30 to 9, and then we see patients in clinic from like 9 to 4. Wow. It's really nice. And then and then as a second year on, you can take 24-hour call. And so our mid-level calls, so the mid-levels are the second years and the third years, you are all in the same call pool. And, you know, there's so many calls per year you have to fill. So the second years take 2/3 of those calls, and the third years take 1/3. And so, I mean, compared to first year, I feel like it's amazing. I hear that third year, you're like done with all your calls by September, which is awesome. Yeah. But I mean, I'm on call. I was on call last weekend, and I'm not on call again until like the end of April. And I'm on call in June. So it's manageable. Yeah, it's like a Saturday 24-hour shift. Fine. And then there is one rotation that we do obstetrics on. It's this other hospital, a part of our program. It's in Raleigh, and it's like a big obstetrics powerhouse. Like they call it the baby factory. And so we do a lot of OB. It's really good because it lets us see what it's like to be like a general OBGYN doctor, because one day we'll do OB and we'll be like 24-hour call. The next day we do GYN surgery, and then the next day, well, we're post-call, then GYN surgery. So it's like 24-hour call every 3 days, which kind of sucks.
That's hard.
Just power through it, and our team is like interns and off-service residents. So you're kind of like the upper level on call.
Oh, wow.
Which is scary, right? As a second year, you're like the oldest one there. Yeah. But it's cool. After you do it, you feel awesome.
I bet.
We do one off-service rotation as a second year, so I'll go to the SICU in a couple months, and so that'd be nice just to learn how to manage the acute post-surgical patients, which helps, you know, in a surgical residency. Everybody talks about how it's weird because we have men patients at that point, and we're like, oh
yeah, I haven't seen one of you in a while.
Yeah, exactly. But that's pretty much it. And then third year is essentially like the rotations we've done already, but you have more responsibility and less call, so that'd be nice. Yeah.
That sounds so great. And then you said you're thinking of doing MFM, maternal fetal medicine, which is like high-risk pregnancies.
Yeah, exactly. I really love obstetrics, and I really like medicine, you know, and so it just gives me a chance to do both. Both things. So really complicated things and really fun things at the same time.
Yeah. Wow. Well, you've given us such a good rundown of OB/GYN. Thank you so much. I always just want to say OB and like cut off the GYN.
I know. Everybody does it. It's fine.
It's so easy to say that. Like, no, don't forget the GYN. So thank you so much. Anything else? Any other like tidbits or things you wish you'd known going into it, or things people should know about the field if they're thinking about it? I'd
say don't be put off by people saying that, like, oh, you're never going to have any time off, you're not going to be able to have a family. Because people still say that. I think that just having an open mind, one of the things I did do, and they probably thought it was crazy, but even outside of OBGYN, when I would have an attending that was a mom, or a resident that was a mom while I was in med school, I'd be like, I have a kid. How do you do it? How is it? What are you doing for childcare? Because I am a huge proponent of working smarter and not harder. Do not reinvent the wheel. Do what someone else has done, because it's really easy to get like down on yourself and feel like, oh, no one has my steps for. No one doesn't have research. Everyone is doing this.
Right.
And that's not true.
Yeah.
And so I think that just making sure that you talk to people, and like the worst people can do is say, no, I can't help you.
Right.
But you'll never know unless you speak up. So I'd say like that is the number one piece of advice. But then if you guys have questions about OBGYN, you can email me anytime. It's very fun.
That's such great advice. Thank you so much, Jasmine. That was wonderful. I think that people are going to learn so much and love it. Everyone, I hope you really liked hearing from Dr. Johnson and all her amazing advice. I'll leave her information in the information for this video. And don't forget to subscribe. And we'll talk to you all later. Thank you so much, Jasmine. Bye.
Thank you.